Hello, welcome to Premier Dermatology. I'm Dr. Missy Clifton, and I'm here today with our laser technician, Elena.
Hi.
How are you?
Good.
Good. Elena is a certified laser technician, which is really important for you to know as a patient. She has gone to advanced training at the National Laser Institute in Chicago, in addition to having training intensively with each of the devices that we have here at Premier. Today, she's going to be performing laser hair removal on our beautiful patient, Kristen, who you can't see, but you can see her cute little legs. Laser hair removal is one of our most popular procedures. It's very effective. Now, with newer devices like our Splendor X that we'll be using today, it's virtually painless, which is wonderful. Back when laser hair removal first came out, it was not comfortable, and I know because I was a patient that got laser hair removal at that point. So now it's a very comfortable procedure, and patients tolerate it very easily.
Very comfortable. Mm-hmm.
Very good. So our Splendor X is a fantastic device. It's one of the most powerful and up-to-date lasers on the market for laser hair removal. It has two different wavelengths. One of them is 1064 nanometers, which is ND-YAG, which is super safe for people that have darker skin types. So we can do laser hair removal on virtually any skin type with this device. For Kristen, who is more fair, we're going to be using the 755 nanometer wavelength, which is an Alexandrite wavelength. It works great for people that are fair with darker hair. And so Kristen is actually the perfect candidate for laser hair removal. It's more effective and happens faster with usually fewer treatments if you have darker hair and lighter skin. Usually the darker your skin, the more treatments it's going to need to take. So Elena, normally for someone like Kristen, how many treatments would you recommend?
Minimum of 6 treatments.
Very good. And how often would she come in for those treatments?
Anywhere between 6 to 8 weeks.
Very good. And what's the main reason for that? Is it something to do with the growth cycle of the hair follicle?
Yes, we're wanting to catch the very next hair growth cycle.
Right, because it works best when the hairs are in the growth phase, the anagen phase, correct?
Right. Mm-hmm.
Okay, so that's the really important thing to know is that you do need to space it out the right amount of time, or you may not even get the results you're wanting, or you could even waste a treatment. So that's one of the more important things that Elena has shared with us as well. She has that advanced knowledge. A lot of places that perform laser hair removal do not have experts like Elena who have this degree of training and really know the importance of using the right wavelength, the right patient, and the right distance between treatments. So Elena is actually doing the treatment now, and you can see the little square. The little square is basically the focal point for the laser, and she can just move it along and treat all of the hairs in that little area. And you can see it's a very, very fast treatment. What's happening here is the device is blowing cold air onto the skin at the same time that the laser is being pulsed. So it's extremely comfortable. You rarely feel a thing with this laser device, which is fantastic. It also has a feature that a lot of laser devices have, is that it has a suction feature. As the laser hits the hair, there will be a little singe or a plume as that energy is being absorbed by the hair. And so that suction removes that plume, so it makes it very safe for the operator and anyone else in the room. You're not getting cells from the patient that you might potentially inhale like you have in the past with some of these other devices. So that's why you don't see us wearing a mask or anything like that with this device. So Elena, do you do any overlap?
20% overlap.
20% overlap. It's a much faster procedure than a lot of other devices we do.
Yes.
How long do you usually schedule to do someone's lower legs?
Lower legs, it's about 30 minutes. That's from start to finish, though.
What would you say the most popular locations are for laser hair removal, Elena?
Probably legs. Second is underarms, and then very popular is the bikini area, just because nobody wants to mess with shaving every day.
Right. What about for men? I know we have quite a few men that come in for laser hair removal as well.
We do. Back is very popular for men, and also that neck beard. They don't want to shave it. It gives them bumps. It irritates their skin. And this is a permanent solution to get rid of that hassle.
That's a wonderful treatment for guys, for sure.
All right, I'm going to switch over to this side.
So we know the treatment's working because we can see this perifollicular erythema, which means redness around the hair follicles. So we know that that hair follicle is taking up that energy, and that energy is being used to destroy that hair underneath the skin. The surface of the skin is just reacting from the heat being absorbed by the hair follicle. And that means that the energy is perfect and that she's going to get a really nice result. Kristen had also just asked me what hair follicles are being affected. Well, energy is being absorbed by every hair follicle, regardless of whether it's in the growth phase or not. But only the hair follicles that are in the growth phase are really going to be targeted. Those are the ones that are going to get destroyed, die, and then fall out. So that's why it's important to continue to do this and get as many of those hairs in the growth phase as you can with each treatment. All right, so Elena, for laser hair removal, what do you tell patients beforehand? How do they need to prepare so that they get the best treatment?
If you're waxing, to stop waxing 4 to 6 weeks before treatment. When you start these treatments, we want you to just shave from now on, and also to come in with your legs or the area shaved.
And is it better if they come in without lotion and things like that for the day of treatment?
Correct. Just clean skin is what we need.
Okay, perfect. So right after treatment, we know there's going to be this redness around the follicles. What is the patient going to feel?
It's going to feel like a sunburn. It could be a little bit itchy. You could have some heat radiating. And if it bothers you, you can put some hydrocortisone cream on to calm it down.
Okay, what about like ice or something like that if they needed it?
Yes, you can do ice packs if it's really bothering you.
But most people probably don't have that much pain
It's
at all.
very mild.
Okay, excellent. And then as far as care after, do they need to shave immediately or not shave?
We want them to not shave for about 5 days because the hair follicle, it's already dead and the skin will just be pushing it out.
And then as far as lotions and things like that, you said they could use some mild hydrocortisone if they were irritated, and just lotions that don't have a lot of fragrance, I presume.
Yeah, that's correct. And if it's any area like the face, we do want you to wear sunscreen and no sun exposure while you're doing treatments.
But does that apply really for any part of the body? The more you can be out of the sun, the better?
Yes.
And if you come in and you have an active tan, probably not going to do treatment, correct?
No, we're going to ask you to come back in about a month when you had no sun exposure.
Okay. So this is a great treatment to do as we're going into summer, but maybe not during the summer, and then later on in the fall after you've been out of the sun.